Thank you, Governor Evers, for this opportunity. I understand that the purpose of these highlights of clinical staff around the state is to help bring the COVID-19 experience to life. Our organization started talking about COVID-19 in January 2020. As a chief medical officer, it is my duty to highlight health topics and public health concerns that are emerging across the globe to ensure that our providers stay well informed, especially so that we know how to educate and advise our patients. At that time in January, COVID-19 was touted as being just like the flu. However, this virus has proven itself to be vastly different than many that we've seen in the past. Like many other health providers, I was glued to the computer reviewing CDC and WHO updates and COVID dashboards and immersed in conference calls with other like entities, trying to get a handle on what our collective response to this larger than life virus would be. At first, testing was so limited and PPE was so scarce, we felt very ill-equipped with the existing resources. It was a very humbling time. As the weeks and months passed, our clinic, along with the other Milwaukee area federally qualified health centers, were commissioned to become testing sites. Testing supplies and PPE resources became more available through various partnerships, and we were glad to contribute and serve Milwaukee's most vulnerable populations through this effort. To date, we have performed several hundred tests for symptomatic patients, and we are still testing every day. Nationally, we learned about the virus, its spread, and how to decrease the risk of acquiring it. We had more information in our armamentarium to help us further educate and inform patients. We were constantly updating our processes and procedures to match the ever-changing guidance from regulatory bodies. As such, our clinic's leadership had to make the tough decision to curtail operations, relegating clinic visits to patients who absolutely needed to be seen in the office, and canceling preventive visits such as physicals, pap smears, mammograms, and routine dental visits. And although we have developed our telehealth process during this time to offer patients the ability to still connect with their provider while remaining safe in their home, the overall reduction in services financially has impacted our clinic. But we realize that financial impact is not unique to our clinic. Several businesses in our state have been hit hard. It's been a challenging time for us all. As a primary care provider, I talk a lot about prevention with my patients. We are all familiar with the axiom, an ounce of prevention is worth a pound of cure. I couldn't agree more with COVID-19. After the weeks and months of research and testing, the best remedy for COVID-19 still continues to be social distancing, wearing masks, washing and cleansing our hands frequently, and sanitizing commonly used surfaces. COVID-19 has proven itself to be no respecter of persons. We have seen both the rich and the poor affected. We have seen people in all age groups affected, and we have seen so many succumb to it despite race and gender. It has literally taken life from us right before our very eyes. And because no cure exists yet, we must not become careless in our activities and our social engagement. I absolutely understand that businesses have to start opening back up. Countless business owners and leaders are looking at how to do just that and open their businesses in the safest way possible. As a doctor, my mission is to protect my patients in all that I do. As a chief medical officer, I make it my mission to protect my staff in all that I do. I cannot fulfill either of those missions if our community as a whole is so quick to resume the normal that we once knew and forfeit the public health gains that we have seen when safer at home orders were in place. This battle with COVID-19 is far from over. And although healthcare providers have seen some improvement in testing and supplies, we are definitely not where we need to be as far as resources are concerned. As I mentioned, this journey has been humbling and challenging, but we know what to do. There is talk of a second wave in the fall, but we have to remember that our decisions today will impact what we will be allowed to do tomorrow. I do not want us to go backwards and see a rise in cases in our state. Each of us has a responsibility to ensure the improvement in our community, and I'm asking each of us to do our part. Again, Governor Evers, I am extremely grateful for this opportunity to share just a small aspect of my journey. I will now turn over the discussion to Secretary Designee Palm.